Hi, and welcome to a short introduction on Sileo, a sound solution for noise anxiety in dogs. So how does Sileo work? Well, Sileo is dexmedetomidine, an alpha-2 agonist. The locus coeruleus in the brain is involved with behavior and stress and controlling those responses. Stressors increase the release of noradrenaline from the locus coeruleus, and so Sileo targets those alpha-2 receptors in the presynaptic neurons, preventing the release of noradrenaline and therefore giving the anxiolytic effect. Sileo is not dexdomitor though. It's quite a different formulation and it's given in a different way. So essentially what happens when it's given by the oral mucosal route is you get only a quarter or 28% of the bioavailability, and therefore it's a subsedative dose. So you get anxiolysis without sedation. So when to administer Sileo? First of all, you can administer it preemptively. If you know there's going to be a noise event at a certain time, give it 30 to 60 minutes prior. If you notice the dog is anxious about a sound that you may not be able to hear, then you can give Sileo. And also, as soon as you hear the sound, then you can put the dog onto Sileo. Dosing with Sileo is pretty easy. It's just a simple, straightforward dial-up syringe. The pre-filled syringes contain 3 ml, so that's enough for 4 doses for an average 20-kilo dog, and each dot gives a 0.25 ml increment. And the dosing chart is available on our website and in the package for your further information. Redosing up to 5 times every 2 hours. Shelf life is 4 weeks, so it lasts, once you've opened the cap, it lasts for 4 weeks. One thing to note is that the cap is quite firm, and so important to point out to clients about the cap. And storage is just simple room temperature storage. Overdosing. So overdosing can be quite difficult. The buccal mucosal pouch in the dog is quite small, and so if any excess is given, it just generally dribbles out of the mouth. If it is swallowed, the bioavailability of swallowed or oral dexmedetomidine is pretty much close to 0. And of course, the bioavailability is only about 28%. So worst case scenario, you give a full 3 ml dose to a 2.5 kilo dog. That equates to 300 micrograms of dexmedetomidine. Essentially, all that will happen is the dog will become sedated. And of course, you can reverse this with antipamazole using 1/16 of the dose of Sileo. So in summary, Sileo can be used in acute situations. It's got a rapid onset of action of 30 minutes to 1 hour. It's very easy to give. You don't have to worry about pills. And in fact, you're holding the mouth shut as opposed to trying to get the pill into the dog's mouth. But most importantly, it calms without making the dog drowsy. Sileo can also be used for long-term administration, so combined with other treatments or with behavioural modification programs. So Sileo can be used as and when needed. We've got heaps of more information on Sileo on our website, glapharma.co.nz. We've got some cool materials and stuff for clients, including tear-off pads, dummy syringes, and posters. And also check out our extensive range of other products. Thank you.